Ghassan, we've talked a lot about the good part of all these different therapies, the responses, the improvement in survival. But of course, one has to also consider the potential side effects that can happen. So, can you discuss some of the potential side effects of liver cancer treatment, how these are managed, and how patients can get support for some of the side effects that can occur?
The perception that sometimes patient might have, and understandably so, that, oh my God, chemotherapy is going to be bad. I'm going to get nausea. Number one, chemotherapy is not used, as we said, in liver cancer. Number two, yes, adverse events can occur or side effects can occur in liver cancer. And we'll talk about a couple components. In regard to the targeted therapy, the hands and feet might have a little bit of redness and peeling of the skin. Very important to keep communication with your doctor all the time. And if anything, to emoliate the skin, make sure it's kind of like always treated correctly. And sometimes if dose reduction is needed, we'll do it. It's not giving up things. We have a lot of margin regard to how much we can treat. Number two is some weight loss can occur. Make sure you work with your doctor in regard to some appetite management. Number three, diarrhea can occur. And of course, this is easily managed with antidiarrheals as well. Now we come to the immunotherapy part. The immunotherapy, the good thing is, thankfully, most of patients will feel nothing. Actually, ironically, sometimes even people can ask even if we're really giving the therapy because they really don't have any symptoms. Nonetheless, the immune therapy, we have to remember that we are leashing out. We are kind of like making a full go for the immune system against the cancer, which means it also can have a full go against our own body. So, for example, some itching on the skin, some rashes as immune reaction to the skin, some joint pains, some diarrhea, some shortness of breath, yes, can occur. In addition to that, there could be some more drastic, thankfully, very rare, if anything like poor thyroid function, weakening of the thyroid, sometimes even induction of diabetes can occur as well. Very important, any symptom, this always will tell patients, any symptom you don't like, call the doctor, because they can either reassure you or they can manage it accordingly, which, by the way, if side effects happen, doesn't mean that we stop the drug. You can even re-engage the drug, but with an adjustment regard to the therapy intervention per se. With all this said, it's fascinating, and not that we wish that, but I remember historically, patients come to us and say, I got nausea. Does it mean the drug is working, like chemotherapy? Well, interestingly, we never had this connection, but amazing, we just published recently that patients who get immune-mediated adverse reaction or side effects, like, for example, the rashes, the itching, the diarrhea, not that we wish it, not that we want it to happen, but believe it or not, we have now proof that when you unleash the immune system with the immune therapy, patients will respond better. So actually their outcome is better. So if it is a subtle component, we have to sometimes support our patients on it and explain it to them and have them accept the fact that thankfully they're doing well. If it's a limitation that really can be managed with some supportive medications, it probably have a good outcome to begin with anyway.
So I think that overall, it seems like these medications are well tolerated. These adverse events can be managed as long as there's good communication between the patient and the provider. And I think your point's well taken that if you have one of these side effects, it's not necessarily a bad thing. This can actually be a silver lining, that the medications may actually be working well, and you may have a higher chance of response to the medications as well.
I totally agree. I mean, and I think it's always wonderful to meet you and talk about and see how we can help our patients. We're very proud of how much we can help patients. But really, the big thanks as well for all the support that we get from every corner of what's needed for that part. And here specifically, would love very much to please our patients to visit www.youandlivercancer.com. And this is to the great thanks of Blue Faery, whom we spoke, and they're a great advocacy group that we are honored to work with as well, because they help us guide also what patients are in need for. And of course, big thanks also for Mechanism in Medicine. Thank you very much for listening.
Thanks a lot.